Welcome. My name is Lenore Janisak. I'm your host for Community Health. Tonight, this program is about you and for you. You're watching a live call-in television program brought to you by CAN TV, and in the next 25 minutes, you're going to have an opportunity to call in and make comments at the number listed below, 312-738-1060. Tonight, our guest is Dr. Dan Fedeli. Thank you for being with us tonight.
Thank you for having me, Lenore.
Tonight, we're going to discuss the health benefits and the cost savings of chiropractic care. Our program tonight is brought to you by Save the Patient, a non-for-profit organization whose mission is to educate, inform, and empower you to take control of your own health care. Again, our guest tonight is Dr. Dan Fedeli, who is, of course, a chiropractor and the founder of the Balancing Center in Chicago. Tell us more about yourself, Dan. Dr. Fedeli.
Dan's fine here.
Okay.
I've lived in Chicago and practiced here for 27 years. And I got to Chicago through a special technique I do in chiropractic, and some of that we're going to be sharing with you tonight. I grew up in Pennsylvania. I live here in Chicago with my wife and my 7.5-year-old son. And the process of developing the system that we're going to be describing tonight has been one of evolving pieces together of things that work together and fit together. Part of my exploration is very practically oriented in ways for people to feel better, get healthy, and enjoy their life.
What made you become a chiropractor?
You know, it was a sort of a grace-filled event. I grew up in Pennsylvania, and I trained horses and took care of horses, and I had allergies, I had sinus problems, I had back pain, and all of which I accepted as normal. If I took a sinus medicine at night and I didn't have a pounding headache by the morning, I thought that was pretty much of a win. And by the time I got into college, some friends were staying who had moved out of town with a chiropractor down the street, and I didn't know what chiropractic was. In fact, I made fun of a woman who went to a chiropractor when I was younger. And he realized that I was in pain. I'd hurt my back, and he took me into one of his rooms, and he manipulated several areas of my spine. And lo and behold, my headaches cleared up, my allergies cleared up, my sinuses drained, and my back hurt less. Now, that wasn't an overnight thing, but I'd had pain unknowingly that wasn't normal my whole life. And he told me that the spine affects the body, and the spine actually affects the nervous system, which runs the body. And that by adjusting or correcting misalignments in the spine, the nervous system was free to do what it was designed to do, and that is to be whole, well, and healthy. And I thought that was the most sensible thing I'd ever heard. I'd had 2 or 3 years of pre-vet and some business courses, and within 6 months I was in Davenport, Iowa, going to chiropractic school. Now, just discussing this here will help you understand what happened. I got to chiropractic school and I realized I wasn't taking aspirin anymore, but I was getting a lot of adjustments. And I remember my mother saying, "Can't they do too many of those?" And I said, "No, if you don't need them, they don't do them." And I ran into a chiropractor there, and he told me that in the upper neck area, there's a misalignment that is more difficult or requires more precision to correct. But once the head and neck is balanced, the hips also come level, and the spine becomes more self-correcting. And I experienced that for myself, and I didn't need so many adjustments, and I stayed better longer. And that finished out my career in chiropractic school and got me to Chicago. I worked with a man named Dr. Marshall Dickholt, who I think you've had on your show.
Yes, we've had him on the show.
Great. He's done some great research with the University of Chicago, showing how blood pressure can actually be lowered like 17 points of a controlled placebo-driven study of just doing this one adjustment. And I worked with Dr. Dickholt for about 6 years, mentor, second family to me.
Wonderful man.
And I realized that I still wasn't living as fully and completely as I wanted to. And I got introduced to another man named Dr. Morter. Now, his technique is not the NUCCA, but it's the BEST or BEST technique. And these links are on my website at thebalancingcenter.com. And you can get links to these different groups to see a little bit more of that. And Dr. Morter's philosophy is that, yes, the body is designed for wellness and wholeness, but it's programmed to survive. So once the body has had a situation, a trauma or a strain that caused it to make a response that gets locked in as normal, now that's not seen as a problem anymore. So adjusting it, if it goes back to its old programming, wasn't allowing my system to get the freedom and the ease that I wanted and I saw in other people. So just by gentle touching, and the Nuka work requires no cracking either. So there are people who are experts at doing manipulation. This isn't to slam other kinds of chiropractic. It's just to educate people that there are different ways of doing it without having the repetitive manipulation kind of chiropractic.
I want to remind you that you can call into our show and ask questions or make comments to Dr. Fedeli. Again, at the bottom of your screen, 312-738-1060. What is chiropractic care? And actually, you started to tell us what does a chiropractor do, but I think there's more to that story.
Mm-hmm.
And what does a chiropractor do?
Well, a chiropractor could work many different ways. So in the Nuka work, we have to back up 1 second. When the neck and head are misaligned, the body has to compensate in that area, which causes the whole system to be out of balance. And that would create 2 or 3 areas of lock and strain. So when you go into some chiropractors' offices, they work on what chiropractic talks about as subluxations.
Meaning
Meaning a misalignment in the spine affecting the health. So they may adjust those 3 regions repetitively or over time to get some results. If you went to a Nuka chiropractor, they would take specific x-rays of the neck and through a very gentle, leveraging type of a correction, bring the balance back to the body so that it becomes more self-correcting. As we support those changes, we can also integrate it into people's lives with movement.
we have a caller on the line. Please go ahead. We have a caller on the line.
Hi, yeah, this is Freddie Weaver.
Hello?
Freddie Weaver, go ahead.
I just wanted to say that Dr. Dan, I'm a patient of his, and I love the work, the subtlety, and it's really very effective.
Well, thank you for sharing that. Now you have
Thanks there.
That was very thoughtful.
Thanks, Freddie.
Well, as long as we have a patient here, how does the patient benefit from chiropractic care? What's your goal or the intention of when you work with a
You know, the goal or the intention is one of producing wellness. And wellness means health, vitality, responding to the environment, and being able to make better choices in your life because you actually can feel what works and what doesn't work. To get there, however, you have to go through relief, and after relief comes correction. And the medical model has sort of taught us that relief is the end product. And if you don't come for a corrective process, there's never a correction of the infrastructure to keep you from falling back into the problem and continuing to degenerate. Now, the caller that just called came in and had a reason that his back bothered him because he had a physical abnormality in his spine. So his story was that that was why he had lower back pain. When we were able to get his hips level and get his spine centered again, he doesn't have that kind of problem anymore. So attaching a meaning to something, unless you keep looking for other ways of handling it, can sometimes actually be a limitation.
You know, one of the things that I realized about you is the fact that you also are an holistic care physician, and doctor, is as far as looking at the whole person. You look at their emotional as well as their physical and spiritual altogether. That's a very unique thing. Can you tell us more about that?
Yes, the body will make responses to trauma, and trauma can be from a sharp impact on the body or a strain over time. Once the body's locked in a response, it sees that as normal. Now that could happen from a belief system we had, an especially challenging portion of our life. People who are in auto injuries, this is one story I tell, they're out having a good time, they hit a bridge, they roll over, they crawl from the car, and they're better in 6 weeks. The person who's in the middle of a divorce going home from losing their job gets hit on the expressway and sometimes never recovers because of the strain the body was in at the time. So we need to look at the whole system because the connective tissue communicates the whole body, the nervous system communicates through the whole body, and the chemical or the endocrine system communicates from the body.